Hi, I'm Dr. Eric Westman, and this is the Keto Made Simple podcast.
Hi, everyone. Dr. Eric Westman here. Welcome back to my channel or podcast where I review and debunk nutritional information online. Although today is going to be a little different. It's my great pleasure to be able to talk to a mover and shaker in the mental health world, Dr. Christopher Palmer. Thank you for being with me.
Thank you for having me, Dr. Westman.
Well, so as I like to talk with folks, assume people don't know anything about you. You know, you're what you've done, and how did you get into low carb, keto, mental health in the first place? You know, the backstory.
How much to share? So I'm happy to share all of it, but the long story. The quick version is that, I actually highly relevant that I had mental illness when I was a kid, OCD, chronic depression, suicidality, due to a lot of different reasons. My mother actually had a chronic psychotic disorder that she developed only when she was in her 40s. So I kind of knew two different.
Can I just say I had no idea.
Oh yeah, no. So highly, and that's actually highly relevant. So I kind of had a quote unquote normal mom up until about 12 or 13 years old, and then through a constellation of horrible, kind of tragic life events in her family, she ended up having what started as what she called a nervous breakdown, but progressed into depression with psychotic features, and unfortunately the psychosis never went away. And she got a lot of mental health treatment. It was worthless for her. That I was actually furious with the mental health field for not being able to help her. I thought mental health professionals are a bunch of incompetent, arrogant snobs. That's
Wait, is this before you became one?
This is before I became one. So now I'm an incompetent, arrogant Harvard psychiatrist. People always laugh at that. So that at least helps inform why I became a psychiatrist. I actually went into the field because I recognized how devastating mental illness can be to people and families, and how it can absolutely ruin lives, it can ruin families, and what an utter disaster the mental health field was. And so I actually went into it not out of a love of the mental health field, but actually out of a strong dislike and just disapproval of the mental health field, and wanting to change it.
Yeah. Okay.
Wanting to change it.
From within, right?
From within. And also in the meantime, just wanting to help patients, wanting to do better than what I saw being done for people like myself and my mom. So there I am. I went through a lot of adversity, actually flunked courses in high school. If you saw my high school transcripts, everybody's always shocked. Like, how the hell did you get into Harvard? Well, they didn't look at my high school transcript. They only looked at college and medical school. And so by then I was doing better, but when I was doing my residency in psychiatry at Harvard, I developed metabolic syndrome, the whole thing. I was developing high blood pressure, prediabetes, my lipids were awful, my triglycerides were through the roof, my HDL was really low, my LDL was high, everything was bad. And the doctor kept telling me diet and exercise. I kept doing a super low-fat diet and exercising regularly. And everything just kept getting worse year after year. And the doctor was starting to push medicines on me, telling me, it's not your fault. It's genetic. You've got a family history. Don't worry about it. Just take your medicines. But I'm only in my 20s. And so I'm thinking,
be a good patient.
Be a good patient. Be a good patient. and always making me feel like somehow I wasn't doing the diet and exercise right. But I was like, no, I'm on a super strict low-fat diet. I really am. I'm not lying, and it's just not working. And so I had heard through the rumor mill from various friends, they had heard about this crazy diet called the Atkins diet, that where you eat a lot of eggs and maybe even bacon in the morning, and it was somehow lowering cholesterol and improving diabetes.
And when what year was this? Just to
this in the late 90s, mid to late 90s.
Same time when this was getting national attention again, I think.
Yes.
Yeah.
And so initially I was highly skeptical of all of that. Initially I was just like part of the regular medical establishment. I was almost mad at people for suggesting such absurd, dangerous, outlandish things like eat eggs in the morning to lower your cholesterol.
It's a good thing it's a good thing I didn't know you then.
That's just an oxymoron. Like that doesn't even make sense. But I was trying everything the doctors were telling me. And finally the doctor was like, you're going on meds. You have no choice. We're done. We're done with this diet and exercise stuff. And I had one or two friends who were passionate enough about it that they were saying, no, Chris, it really works. Try it. And so I decided, you know what? I'm going to give it a shot. I'm going to do this Atkins diet. I really didn't think it would work. So I was like, but I'll give it a shot for a few months and see what happens. And then I'll bite the bullet and take meds. And within 3 months, my metabolic syndrome was completely reversed. Everything was better. My blood pressure was normal. Actually a low, healthy normal. My triglycerides were way down. My HDL my LDL cholesterol, the one that everybody worries about, it went down. Mm-hmm. For me, it went down. My prediabetes was gone. But the thing that I noticed was that I had mental health benefits that I had never experienced in my life. For the first time in my life, I was waking up before my alarm went off and feeling rested. I had more clarity of thought. I had more motivation, more energy. And it was actually striking. I had never, ever felt that good in my entire life, even when I was a kid. I had never felt that good. And I really was shocked because I thought, this is impossible. This is not who Chris Palmer is. Chris Palmer is that loser, that pathetic loser. And somehow I'm feeling really good now. And so I just kind of made mental note of that. I wasn't going out and telling people about it, especially not at the hospital, because I'm doing this crazy Atkins diet. Nobody's going to approve of that. So I went over.
Were you still in training then? Or
I was doing my residency.
Yeah. So had you had any notion that what you could eat could affect your health, let alone your brain and your nutritional background? Or
I was told that what we eat would affect our health, but I was told that it was fat, that eating too much fat is what makes us both fat, and it's what also causes metabolic syndrome and causes high cholesterol. And so so eating fat and cholesterol is the evil thing. And if you just eat less of that, everything will be fine. So that's what I was taught, and I really believed it.
In training, I kind of, the two things were smell a little fishy, like smelling a rat, sort of suspicious. Because if cholesterol is so bad for us, why does our liver make more of it when we eat less of it? And then if saturated fat is so bad for us, why does our liver make saturated fat and store it as energy? And was there anything in your training that just sort of maybe primed you for something that didn't, well, except your experience didn't make sense? Everyone said, yeah, okay.
my experience didn't make sense. And quite honestly, I'll be honest, I didn't give it that much thought. I just, there are so many things in the medical field that we should be questioning. And I was focused more on psychiatry. Like, is it really a serotonin imbalance? Why aren't these medicines working then? What is lithium doing? How long do people need to take these medicines? My mom took these medicines and they didn't work for her, and they're not working for these patients. What the hell's up with that? I was actually much more focused on those things and those kind of challenges and things that just weren't adding up. And I was less interested in cholesterol and the liver, and I'm a psychiatrist. I'm interested in the brain. So I was just thinking, the experts know what they're talking about, and they're telling me eat less fat and cholesterol, and that'll make you healthy. And it just wasn't working. And so within a year, I have friends and family noticing these changes in me, noticing that I had lost a little bit of weight. I actually was not technically overweight, but I had abdominal obesity, which is a sign of insulin resistance. But I was kind of one of those skinny fat people where I was relatively skinny and unathletic and had a little bit of a gut. And so I didn't need to lose a lot of weight, but I certainly lost the abdominal fat, some of it. And friends and family had noticed that. And more importantly, they noticed me being able to resist candy and sugar and pies and other things at Thanksgiving and other events. And they would get really upset, I think more with themselves, but they would direct it at me like, how are you doing that? How are you not eating the pie? And like, we are eating the pie and the cookies. We can't resist, but we want to lose weight. How are you doing this? You don't need to lose any more weight. What's going on? And so pretty quickly, I convinced a few of them to try this out. And like, your cravings will go away. They really will. Just get through a couple months of it, and you won't crave this stuff anymore. And it's not hard for me anymore to give it up.
Just a shade. I say after a couple of days, the cravings will go away, just so I don't scare people that months. Most people won't wait a month anyway.
I'm the opposite. I actually prepare people for the worst. I tell them it's going to really be awful in the first week or two. It's just going to be absolutely tormenting.
And then
we'll get you through it. We'll get you through it. Invariably, they come back to me and say, it wasn't nearly as bad as you made it out to be.
So for those watching, this is the psychology used by a trained psychiatrist. I just pretend to be, I'm a son of a psychiatrist. So that's funny. I usually barter for, just try it for a day. It's going to be easy.
I like to set the expectations low and then have them be pleasantly surprised.
I'm going to have to try. In fact, that should be a randomized trial of the psychology of starting a keto. It should, because in my experience, the reason I do that is actually I've had people say, oh, it was really hard. Because I started out telling people it's easy. And then I would have them come back to me 3 or 4 days later, like, oh, I just got so famished and I felt a little weak or dizzy or something. And it wasn't easy. And so something was going wrong. And so I knew I needed to break the diet, and that's a dangerous diet. And I'm like, well, number one, you probably weren't eating enough. Like if you're cutting out all of the carbs, if you're going to McDonald's and cutting out the bun and the French fries and everything else and the shake, you might need more than one hamburger patty for a meal. 2 or 3, yeah.
You might need more than one, or you might want to add in a salad or something with it. So that's kind of one of the big mistakes, is sometimes people just aren't eating enough or whatever. And so anyway, I get some friends and family to do the diet, and they too notice not just the weight loss, but significant mental health improvement. They feel better. They just say they're more positive, they have more energy, they're sleeping better, they feel great. And now I'm thinking, wow, this Atkins diet is an antidepressant. That
Was your mom able to try it? Was she still affected?
So interestingly, she did try it. And she had periods of time when she was on the diet that she was actually starting to do better. So my mom had obesity. She had low thyroid hormone. She was on thyroid hormone supplement. She had type 2 diabetes and was on medication for it. So she came in with a lot of hits against her and her metabolism and everything else. She never completely got off diabetes meds. She never did it long enough to completely get off everything. But she did it intermittently. And I would just notice that she was a little bit better. But her psychotic symptoms would wax and wane anyway.
Right.
She would have good months where she wasn't talking about it too much. And then she would have bad months where she was really paranoid and talking about delusions and other things. And so when she was doing the diet, my recollection is she was probably talking a lot less about it and seemed happier. But I didn't make too much of it at that point in time because I had no conception at that point in time that a ketogenic diet could do anything for psychotic disorders. I was just thinking maybe it's an antidepressant. So within about a couple of years, I'm now working at McLean Hospital, which is the flagship psychiatric hospital of Harvard Medical School. We are a tertiary care hospital, so we get people with treatment-resistant severe mental illness. That is pretty much what I have always treated most of my career. It's very rare for me to get somebody off the street with their first episode of anxiety or depression or something else. Usually people coming to me have tried lots of medicines, years of psychotherapy, possibly even electroconvulsive therapy and other treatments, and nothing's working for them. They're still sick. And so within a few years, I'm thinking, gosh, I've got these patients and they've tried just about everything. Like one woman had tried over 30 different medications. She'd been in therapy for decades, was in and out of hospitals, had ECT, and nothing worked. So I'm thinking, hey, you want to think about maybe trying a diet? Now, initially, she was really skeptical, pushed back a lot. And I wasn't trying to force it on her at all. I'm like, if you don't want to try it, that's no problem. But we've kind of tried everything. And if you really want to try medicine number 31, here's one that you haven't tried.
Can I just unpack the acronym ECT, electroconvulsive therapy? So it's the classic stereotypical shock therapy. So I mean, this is very serious, for most. Although I'm told it's being used for less serious disease now, but just so that not only medicine but also the electroconvulsive therapy, tried everything, except
God forbid the change in diet. So she was actually the first success story I had. It took us months for her to even contemplate doing it. I had her get the Atkins book, read it. We talked it over. We talked about what foods would you enjoy eating? What foods don't you want to eat? What's going to be really hard for you to give up? We weren't just going in it. I wasn't just telling her, go wing it. I was like, you got a really serious crippling mental health condition. And I, as a clinician, really want to see, is this possibly going to help you? And it took her over a month to get into ketosis. She was trying different things and they weren't working. We ended up having to try Atkins had described as a fat fast. So basically increase her fats significantly and really lower and restrict her carbohydrates. That was the trick. That did the trick for her. And as soon as she got into ketosis, within a week, she actually got a little bit hypomanic. So that is, for people who don't understand, that's kind of the opposite of depression. So not only did she get an antidepressant effect, she was giddy. She was giggling and laughing and smiling in a way I had never seen, in a way that she said, I cannot believe I feel this good. This is the best I've felt. We started dating. She had not dated in years. And it was working beautifully, though. And she was doing, like, I remember I had been trying to convince her to exercise as a treatment for her crippling depression for over 2 years. She scolded me at one point and said, I get that exercise has been for me, but stop talking to me about it. I'm never going to do it. I'm depressed. I'm lazy. I'm just not going to do it. I don't want to hear the words exercise out of your mouth anymore. So I was like, okay, loudly heard, and I am not going to ever bring up exercise again. Within a month of actually being in ketosis, she comes in smiling, grinning one day, says, Dr. Palmer, guess what I did? I'm like, what? I joined a gym. I said, really? She said,
Now you're worried she's in full-blown mania. Well, but so just for those who don't understand psychiatric illness, especially the bipolar, there's sort of if this is mood being sort of tranquil, people accuse me of that all the time. And if you're depressed, the mood's down. If you're elated, the mood's up. And it's kind of normal to have these cycles, right? But not so normal to be down there all the time. And so she had come up to this. So were you kind of going, maybe there's something to this, or were you still skeptical?
No doubt. No, at that point, I already knew it worked for quote unquote non-patients like myself, because I wasn't doing it as a patient. My friends and family weren't necessarily, many of them didn't even have mental health diagnoses or anything, but they just felt dramatically better. But this was a legitimate treatment-resistant patient with a very severe mental illness.
I guess the importance of that is the spectrum of disease that you would typically see in the clinic. So it's not just that we call people patients to make them, they are people, but they come to us, to the clinical world, typically worse off, at least seeking care for whatever the problem is. But now you're introducing a therapy that it's not a drug. It's people
not a drug.
Do this on their own.
And so now I'm starting to use it in other patients, especially patients who have type 2 diabetes. I'm definitely combining.
That's the cover, right? That's the excuse to see maybe it would help with this because
yes.
By then
And again, I'm only working with people who have treatment-resistant mental illness. So it's not like I'm offering this as a first-line treatment off the street. So I feel very secure in my decision and in my licensing credentials and everything, because I'm, it's like, well, they've tried everything and we're totally off-label now. Anyway, like any other medicines that I'm using are not indicated by the FDA for the treatment of their condition. So I'm out in fringe territory anyway. So let's use a diet.
Well, let's toggle back to thinking about research, because you're getting into that area. We'll get to that in a minute. But it's so important that you know that the disease is relapsing and goes up and down, and because you need to understand that in any research that's done. And then the idea that there may be other factors that need to be controlled for. I guess that's the main thing. So that having someone have a benefit, you don't know what percentage of folks will have that benefit, right? So just because you saw one person climb Mount Everest doesn't mean we all can do it. And then, but I guess my other point was that an area to be in research is a place where no one else wants to be, right? The sickest of the sick, that I will ask other doctors to send me people that they can't stand because they're on 20 different medicines, literally, and diabetes and all these different things. And then, I just kind of do my thing. So having the sickest of the sick is a great research place because no one else really has any other option. It's brilliant.
And it's more compelling to those other clinicians. Because if I took somebody with mild depression and got them better with a change in diet, most clinicians just brush that off as, well, it was probably going to go away anyway. They probably weren't really sick anyway. You were probably just overestimating their level of depression, or maybe they were just whining and complaining and they didn't really have real depression.
Yeah.
When you see these patients who've tried 30 plus medicines, have had electroconvulsive therapy, have been in therapy for decades, there's zero ambiguity. They had a real mental illness.
Yeah, but that doesn't mean those arrogant mental health doctors won't blow it off. They just grew out of it, right? That's the response I got. But the switch. So how you started using? You had brought one of your patients to the Metabolic Health Summit out in, I think it was, the Denver Keto conference. Just unbelievable story of someone down and out, homeless, now organized and dressed up. And is that the same patient you're talking about, or is that someone else?
That's a different one. So I've got a lot of stories now.
Unbelievable.
Really the index patient for me was not that, because these patients, the patient I just described, I was just going along minding my own business for about 10, 15 years. Just like, I'm just doing this on the down low because I don't want to be getting in trouble. I don't want to be having anybody come after my license.
Being the low blade of grass. No one's going to kill.
Yep.
I've lived this.
I was not looking for trouble. I was just looking to help the patients in front of me. And then one of my patients was schizoaffective disorder. So he had chronic hallucinations, delusions. He was tortured by his illness. He was essentially a hermit. He had become obese from all the medicines we prescribed to him. He was oversedated from those medicines.
So you mind spend a minute or two about what it's like to have that disease, to be tortured, you say. I mean, what about people who don't understand, they've never had a family member or not in the medical world? What kind of things would he experience?
So, this isn't universal for all people with schizophrenia, but when you see the homeless people who mumble to themselves and smell, they have schizophrenia or schizoaffective disorder usually. That's what they have. They may have substance use disorders, other things too, but for a lot of them, including him, his torture was that he would hear voices just in his head that he assumed were from people who had targeted him. He made the assumption that there were these powerful families in the world who had all of this technology, and they were evil families, and they just randomly or non-randomly selected people to torture. And so they would put these voices into his head, and the voice would often denigrate him. You're worthless. You're fat. You're a loser. You should kill yourself. Go do it. Kill yourself. he was convinced that other people, pretty much everybody in society, was in on this. So that when he would go out in public, if anybody even glanced his way, glanced even in the direction of him, didn't even look at him, he was convinced they're part of it. They're part of it. They're monitoring me. I know it. Sometimes he would be terrified. Like, they're going to pull out a knife and stab me in the eye at any minute. I know it. I know they've got a knife. Look, he's putting his hand in his pocket. He's got a knife. He's got something, and he's going to come after me any second. Or they were mocking him. If he was out in public and two women way far away at the other end of the park start giggling because one of them told a joke, they're laughing at me. They're mocking me. Look, they're totally making fun of me. And I feel humiliated, and I'm not taking this. They can't do this to me. I'm sick of it. That was his life day in and day out. He couldn't go to a movie theater because he was convinced that somebody would be there lurking in the dark, ready to kill him. He couldn't go on a bus because he was convinced everybody there was talking about him, thinking about him, laughing at him, mocking him, monitoring him. And again, even when he hides in his home for safety, the voices are there. The voices are tormenting him, telling him, you're a loser, you're fat, you're ugly, nobody wants you, just kill yourself. So it's a living hell. I kind of like, even the descriptions of hell that we all hear usually aren't that bad. It is a living hell, and there's just nothing. There's no.
A demonstration of that. Actually, I have to disclaim or make it let you know I'm a son of a psychiatrist, child psychiatrist. I'm not a psychiatrist, but my father always used to say, he was an academic psychiatrist, used to say that physical pain rarely leads to suicide, right? There are pain clinics and all that. It's mental pain, the anguish that leads to suicide. And I remember in training, sitting one night with a fellow who came in a florid psychosis, and it wasn't just the voices with him. It was like he felt the whole body felt the anxiety, the pulse is going rapid. I mean, it's really remarkable to see. And you can't fix this, can you?
And so this man asked for my help to lose weight. And he'd actually tried some other weight loss methods that did not work for him. And for a variety of reasons, we decided to try the ketogenic diet. So now at this point, I'm far beyond. It's evolved from Atkins to ketogenic therapies. I'm doing blood glucose monitoring. I'm doing all sorts of things, but he wants help losing weight. And I've not seen it work or psychosis or bipolar or anything else. I've just seen it have a powerful antidepressant. And in my mind, these are totally different disorders. So I'm thinking, okay, I'll help the guy lose weight. And like, whatever. I had no expectations that it would do anything for his mental symptoms. So within 2 weeks, not only is he losing weight, but I start to notice this powerful antidepressant effect even in him. And I'm not changing his meds. He's still on the same meds. And he's smiling more, talking more, much more animated. And I'm just like, whoa, what's getting into you? Because I didn't even anticipate an antidepressant effect in him. Because he's got a severe mental disorder. Like that is the sickest of the sick. Schizophrenia is the sickest of the sick. And so I'm like, wow, I'm shocked that it's even having an antidepressant effect in him. Wow, that's dumbfounding. And really, at this point in my career, I have now come to the conclusion people with his diagnosis have irreparable brain damage. that is the way I conceive of their illness, that they are beyond help. We keep trying medicines, we keep trying them, and we're lucky if they reduce the symptoms enough, but they never restore lives. People aren't getting better. People are usually just going on with chronic illnesses. If the medicines work, they stop working after 6 months, and then the symptoms are back with a vengeance. So I really, at that point in my career, have just come to the conclusion, like, these people are beyond help. And it's heartbreaking because my mom was one of those people, but it's kind of like there's nothing we can really do. We don't know what to do. We don't have anything to offer these people. Nothing works. Electroconvulsive therapy doesn't help them. Medications medications reduce their symptoms, get them out of trouble, keep them out of jail, but they're not curing them. And so 2 weeks, antidepressant effect. So it's not happening right away. About the 2-month mark, so 6 to 8 week mark, or something like that for him. First, he says, you know those voices that I hear all the time? They're going away. They're starting to go away. I'm not really hearing them that much. And when they do talk, I can ignore them. I'm done with them. I'm sick of listening to those voices. I'm just going to ignore them now. And I'm like, whoa. And the real shocker for me was a few weeks later, he says, you know how I thought there were all those families who had targeted me and they were tormenting me on purpose? He's like, now that I think about it, I don't think that's true.
Wow.
I think probably I've had schizophrenia all along, like all of you people have been trying to convince me, and it's going away. And at that point, I recognized I cannot stay quiet about this. This is way too important. This is nothing short of a miracle.
So 2 months in, though, so it took a little patience. And what was he eating? Just so that if someone's listening and they don't know what keto or low carb means.
He was eating, traditional ketogenic diet. So, and we were focused on higher fat, and now I probably would do it differently even for him because he was obese to start. So he would have like bulletproof coffee in the morning. And then otherwise a very reasonable, sensible kind of low carb keto diet. So chicken, poultry, fish, meat, low carb vegetables. That might be asparagus, broccoli, salads, other things, olives, cheese, those types of things. And he would mix it up a little bit. But we were always going for ketones. And one of the things that I noticed that I'll at least just share if this is helpful is that he ended up falling off the wagon a few times and cheating on the diet, and his psychotic symptoms would almost always come back with a vengeance early on. In the first 6 to 12 months, he was not better enough to be able to cheat. So when he did cheat, his psychotic symptoms would come back. But one time, he was convinced that he was still on the diet, and he came in actually saying, I may need to go to the hospital. I can't take it. The voices are so loud. They're tormenting. I cannot take it. I can't stand it. I might need to go to the hospital. Now, it's important to point out, he hated the hospital more than anything. The hospital to him was a torture chamber. So when he's asking for the hospital, I'm thinking, oh my God, this must be really bad. This is not a good sign. But like, can you step on the scale for me? And he steps on the scale. He weighs 10 pounds more than he did the prior week.
He had some carbs.
And I check out his blood ketones, and they are essentially negative, which is 0.2 for beta hydroxybutyrate. 0.2 is a negative reading for most people. That's kind of a baseline non-ketogenic kind of level. And so I say to him, something's gone wrong. You've gone off the diet. And he's yelling at me. No, I haven't. I'm still on the diet. I'm like, something changed. What is it? He went out and bought these supposedly ketogenic chocolate bars.
Oh, no.
Ketogenic.
Food.
It says keto right on it. So he thought he could have it.
Yeah.
But it was not ketogenic. It clearly threw him out of ketosis. It clearly made him gain weight. And the weight gain he gained was probably a lot of water weight. Because when you start replenishing glycogen, you start getting, some water with that. So the 10 pounds wasn't 10 pounds of fat weight gain. It was probably a lot of water and fluids. But that was the clue. And I let him know, well, whatever you ate, whatever was in that chocolate bar is not allowed. So let's get back on, I'm not going to put you in the hospital right now if you think you can stay safe. And I actually had to check in with him every day. Like, seriously, I need to see you back here tomorrow. Less than 24 hours. I'm really worried about you, but get back on the diet. No keto junk food, nothing new. And within 24 to 36 hours, he was fine again.
Wow.
So with his case, I'll fast forward. I start using this with other patients with schizoaffective disorder. I start publishing research. I end up collaborating with researchers from around the world, Australia, UK, all sorts of places. We have a paper.
We have a paper together.
We do have a paper. I start collaborating with famous people like Dr. Westman. So we have a paper. So word starts spreading. And at this point, we are way beyond anecdotes and stories like I've just been sharing.
What percentage effect? So, the internet can show you what can happen, but it never gives you the denominator to be able to say 50% of people will have, or now for diabetes, the Verta study said that 70% of people can get off insulin with type 2 diabetes coming in. Any idea of what the percentage effectiveness rate is at this point? I know you could just say you got to just give it a try and see, but I wonder if you have enough experience to gauge how effective this is.
The interesting thing is that for people with mild to moderate disorders, like mild depression or anxiety, in my experience, overall, it can be less effective in terms of a percentage. And the reason I think is because mild depression can actually be due to lots of different reasons. And for some people, it is psychological or social reasons. And so they may actually need a psychological or social treatment in order to get better. However, the shocking thing and the paradox is that the people with really severe crippling disorders, it's pretty close to, if I can get them to do the diet 3 months and have ketones for 3 months, that's a big if, because not everybody can do that. But if they can do that, it's above 90% of people who have improvement in symptoms, and usually not just a little bit of improvement, usually a dramatic.
So with that sort of percentage effect, a study of take 20 of the worst, put them in a step-down ward, or it doesn't have to be full-blown hospitalization, but control what they're eating, with permission and all. You don't need randomized trials if it's that powerful. Like when there was meningitis, everyone died. So when you introduced penicillin, there was no need for a randomized trial. In fact, one of the clinical epidemiologists I learned from said it's a good thing they didn't have the power calculation requirement and statisticians that said, you needed a randomized trial on penicillin because you didn't, right? So anyway, that kind of effect, even though people will say you need randomized trial, no, one of the best studies in the diabetes world was just putting 20 people on a ward where they could study everything they were eating and watch the diabetes get better. They actually crossed them over, brought them in on their typical diet, and then changed them over, which might be another way to do research without a whole lot of money. So anyway, that was, wanted to make sure that you were aware that while other people may want millions of dollars for research, a lot of this can be done if it's that effective with the right thought of the spectrum of the illness. So fantastic. And
that study has actually been done. So, and you were a co-author.
well, but it wasn't. That was Albert Danan and the study in Toulouse. But it was his own patients, and it needs to be repeated.
Yeah, I agree.
The signal is there.
I agree, and we've now had two more studies published. One in 20 patients with bipolar disorder. That was an 8-week trial, but the patients were euthymic, meaning they were not in the middle of a severe depression or manic episode at the time. But many patients, people with bipolar disorder, are still having mood symptoms and cognitive symptoms in between episodes. So even when their mood is not officially depressed or manic, they still have symptoms. And so in their study, what they found in those 20 patients is that the higher the level of ketosis, the greater the improvement in mood, energy, cognition, decreased anxiety, decreased impulsivity. They got high levels of compliance. 91% of the daily ketone readings were positive. They measured blood ketones every day in all people for all 8 weeks. 91% of those daily readings were positive, meaning a very high level of compliance with the diet. And they did brain imaging studies as part of that, and they showed improvement in brain metabolism that correlated with the clinical improvement. And then Dr. Shabani Sethi out of Stanford just published her study about a month ago now of patients with treatment-resistant schizophrenia and bipolar disorder. And she too got significant results. I think 79% of the patients had clinically meaningful psychiatric improvement. All of the patients, 100% of the patients who had metabolic syndrome reversed their metabolic syndrome. And what a nice side effect. A lot of them lost some weight too. But that's just the side effect of this treatment. We're really treating brain conditions. And that's honestly the way I think about it. We're treating brain conditions. And isn't it nice that they're losing weight and getting rid of their diabetes and high blood pressure and everything else? It's almost like
we would call the mental health effects a non-scale victory. And you're calling the weight loss a non-brain victory.
Yes, non-brain. And the reality is what we're really doing is we're treating whole human beings as though they are all one thing, like their body, their heart, their pancreas, their gut, their brain are somehow all connected.
So
it's heresy.
Where to go from here? You put together an amazing book called Brain Energy, and really pretty masterful, I have to say, for those of you who haven't read it yet. And then I'll kind of say, well, there's a metabolic health psychiatry unit, at Harvard and Stanford, and have you heard of those places? If someone ever asks. But then how did the your center start, and then tell me a little about the funded studies that are coming up, how all that happened. It's amazing.
There's one philanthropic family, the Bazuki family, that is supporting over a dozen research trials of the ketogenic diet for mental health conditions around the world. So a lot of them are focused on bipolar disorder, schizophrenia, but major depression, anorexia nervosa is being studied.
Yeah.
The federal government is actually doing trials of ketogenic diet for alcohol use disorder, aka alcoholism. And a different philanthropist actually donated $3 million to McLean Hospital that allows me to set up the metabolic and mental health program. So we will actually have the very first consultation service offering ketogenic therapy to people with mental health conditions. To the best of my knowledge, this will be the first psychiatric hospital in the world offering this service to patients outside of clinical research. So that's exciting. And then we've at McLean Hospital, with funding from the Bazuki family, we are doing a trial of the ketogenic diet for bipolar disorder and schizoaffective disorder in people who are between the ages of 18 and 44. I'm actually in talks with other philanthropists who are also interested in supporting this work. So we are looking at doing clinical trials, and even beyond ketogenic diet therapy, we're looking at more broad-based metabolic treatment strategies. And can we use metabolic treatment strategies to improve brain function and get people better? And so we're looking at medications, vitamins, supplements, measuring hormones, making sure people don't have like thyroid hormone deficiency that's just gone unnoticed, or vitamin B12 deficiency that's gone unnoticed. I'm going to be working with basic science researchers who are doing stem cell research, really trying to further prove that metabolic dysfunction in cells can result in symptoms of mental illness. And that even the genes that increase risk for mental illness, a lot of those risk genes have been tied directly to mitochondrial abnormalities or metabolic abnormalities. And so it appears that the risk genes for mental illness are metabolic in nature. And then if you pair that higher risk because of your genes with a really bad diet or otherwise toxic lifestyle, like sitting all day looking at a screen, eating a lot of junk food, that can be a double whammy and obviously it can result in being overweight or developing obesity. It can result in diabetes, but it can also result in the brain malfunctioning, and that means what we call mental illness. And it could be anything. It could be depression, anxiety, all the way to bipolar or even schizophrenia.
And just to editorialize a little bit, this is a great start. It's a lot more money is always needed, of course. Then the end of every paper says more research is needed. But no, this is really just the infancy of or even the birth about something that I hope will really grow. Even I hope Harvard has a lot of different silos. The pediatric endocrinology group, David Ludwig and Belinda Lennertz, hope you could work with them. And then there's actually a surgeon who has a cancer model. His name is Matthew Nez, N-E-H-S. In my office, someone came in with anaplastic thyroid carcinoma, something I hadn't seen in 30 years, and I typed that into PubMed and Keto, and Dr. Nez research came up. He has an animal model there that feels all this is changing, which is wonderful. And are you set up so that if someone wanted to see you at the hospital, you can just come and make an appointment, or are you still like working things out?
So we are, the staff that I'm hiring are actually, 2 of them are starting next week. They still need to be trained, and we just have to set up our clinic and set up our systems. more than likely that clinic is going to serve primarily McLean Hospital patients because it's going to be relatively small in scope to start. Unfortunately, I have a waiting list of over 4,000 people now. And so I am working with lots of people to try to start a clinic that would likely be outside of McLean Hospital, where we will be able to treat a lot of patients. And I probably am not going to be the person treating all these people because I can't treat 4,000 people by myself. So I am hoping to hire clinicians, train them, have team-based care. But the great news is I've got a lot of people, a lot of clinicians who are actively reaching out to me. They too are desperate to better help their patients. They get it. They know that what we're doing isn't always working, and they want new tools, and they love the concept of lifestyle. I'm actually speaking at 3 Harvard lifestyle and obesity medicine conferences.
Cool.
A lot of people are really interested in this work because it confirms things that they kind of already know, but haven't been able to get others to take seriously. That when they help people lose weight using lifestyle interventions, they see their mood or anxiety or ADHD get better, but nobody takes them seriously. And what I'm saying is, no, that is a serious intervention. You're improving, at the same time you're helping them lose weight or improve their diabetes, you're helping improve their brain metabolism, and that makes their brain function better. And although some of those lifestyle medicine people lean more toward plant-based diets with lots of grains and other things, I'm trying to insert that different people need different diets. And if somebody's doing really well with that diet, great. But if they're not doing really well with that diet, let's give it something different.
If ketosis is necessary, and that was one of my last questions, it's going to be really hard to do that with all the carbs and plants. Angela Fitch is a good friend. She's the director of the obesity program there. And although she's more of a medication, obesity medicine doctor, lifestyle medicine is usually a plant-based, alarm goes off. But that's just so awesome. And is there any web presence if someone wanted to learn about this as a patient right now? Like, do you have a website where people can learn, or is there one you would think about?
Yes. So they can go to brainenergy.com. We have a free newsletter. I have a self-assessment that you can take to assess your mental health and metabolic health. It's free. But I would encourage people to sign up for the newsletter. If you're interested in clinical services and being put on this wait list, go to chrispalmermd.com. And you can find more of my academic research there. And the wait list, we've got ketogenic dietitians listed who want to work with mental health people. So they're using ketogenic therapies for mental health conditions. I don't have any financial relationship with any of them. I should probably charge them something, but I don't. I'm doing it as a service to the community. They are just dietitians who want to help people, and I want people. And most of them work remotely. Unfortunately, insurance doesn't cover most of their services, so I put that out there. But and then there's another nonprofit organization, Metabolic Mind, that is run by the Bazooki Group. So people can go to Metabolic Mind and sign up for their newsletter, look at their videos. There's a lot happening. This space is rapidly taking off because the great news.
I share your concern though about if people do it, you want to do it right. You want to do it in a way that's been tested and tried and true, and then it may not be the panacea for everything, or is it? I mean,
well, and there's a really important example that I'll actually give, and she's very public about it. So there's a woman named Lauren Kennedy who has schizoaffective disorder, and she has a YouTube channel called Living Well with Schizophrenia. And she has been out there publicly for years talking about how to live the best life possible with schizophrenia. She actually interviewed me well over a year ago and had tried the keto diet on her own and said it didn't work and gave up. For the past 4 months, she's been working with a ketogenic diet clinician and her own psychiatrist, doing a much more regimented and medical grade, neurology grade ketogenic diet. And for the first time in years, her symptoms are in full remission. And I say that because she's just got a web presence, lots of videos. You can see her videos beforehand. You can see videos of her hospitalized, and you can see her thriving now and almost glowing about, oh my God, this is working. my psychotic symptoms are in remission for the first time. And the heartbreaking thing, she put out a video a couple weeks ago where she actually kind of started crying about what would my life have been like if I had been offered this treatment 20 years ago.
Well, I know.
It's as much as she has been trying to be an advocate for positivity and do well, she's like, this diagnosis kind of took a lot from me. And it's kind of unfair that it wasn't offered to me earlier, but it is what it is.
Hopefully she can channel that into paying it forward to other people.
Absolutely.
But just as a word that this is not a panacea, but and we call it internet keto, where, oh yeah, I've tried keto, it doesn't work. Well, come on. Now that we call it prescription strength keto because we do 20 total carbs, and I don't ask people to measure ketones, but pretty much they're all in ketosis when you're under that 20 total per day. But I want to catch up with you periodically, if that's okay, to see what the latest news is. It's just awesome to see this transform over a relatively short period of time, I have to say, because we look back to that paper in 1950, where they actually put people on a ward to do a keto diet with schizophrenia. And of course, it's so short, the paper, it's hard to know what actually happened. But I think, this is going to happen a lot faster than 70 years.
It is.
I hope.
It is. I think it is. Yeah.
Thank you so much for spending time with me and sharing your story. And I didn't know we had that connection. I walked my mom down the ward hallway to get her first ECT therapy for depression. So that maybe made me a little more open to hearing that in my patient with Doris, who was one of the patients I had, who came in after losing weight after 8 days and said, my voices are gone. And I was back in the chart days, trying to figure out what's she talking about. So anyway, what amazing that this is now going to get some real formal attention.
It is. And you have been instrumental in all of it. Let me just, for people who don't know that, Dr. Westman has been instrumental, not only in telling me about your patient, Doris, and sharing her story and letting me talk with her, and but just all of your support from day one, back in the day when the Atkins diet was that fringe quack diet. And then people like Dr. Westman start studying it and documenting in the medical literature. No, this is legitimate. This is safe. It's effective. It's real. I would never have gotten anywhere if I did not have all of that safety literature, efficacy literature to fall back on and say, hey, this is serious. It's already published. Researchers have already done this work.
Yeah, you don't have to recreate the wheel, which is great, but you're going to be amplifying this and in a new direction that it really has so much potential Thanks again. And
Yeah.
thanks for taking the time to talk to us today.
Absolutely. Thank you.
If you enjoyed this video, be sure to like, subscribe, and hit the notification bell, and check out adaptyourlifeacademy.com.